One of the most important things for a medication to work is to actually be able to use it properly, and that is especially important with topical medications. Hi, I'm Sarika Ramachandran. I'm a board-certified dermatologist, and today we're going to talk about how to apply topicals or topical medications to psoriasis. When we think about classic psoriasis treatments, topical medications are used often, especially when psoriasis is limited to a certain body surface area. There are different types, different forms, and they come in different vehicles. When we're thinking about topical medications, and where are we applying them, okay? And that makes a big difference in terms of which vehicle we want to use. So let's start from head to toe. If we start in the scalp and we have psoriasis in the scalp, for patients who have longer hair or thicker hair, it's a little bit difficult to use an ointment. So for these patients, I like to think about ways that we can actually make the medication get into the scalp and doesn't just get on the hair and not make it into the area that actually has the skin disease. We have a few different things that can be helpful. There are topical steroids that come in the form of foams. We also have them come in the form of solutions. They're alcohol-based solutions that can be applied to the area. There also are topical shampoos. They can be placed into the scalp, left on for a little bit of time, and then washed out. There's also oils that sometimes we use that have topical steroids in them. While they can be very effective, patients don't always want to have like an oily background when they're going around during their daily activities. So in these cases, we sometimes have people use them at nighttime, leave them in overnight, and sometimes wash them out. These are some of the ways that we can treat scalp psoriasis and some of our skin diseases on the scalp. The other things that we have available to us are ointments. Now, ointments tend to be greasy. They can be thick. Some patients don't love the greasiness of it, and sometimes we'll have patients use the greasy form at nighttime and a different form during the day. So at nighttime, maybe use like the kind of the cruddy sheets that it's okay if we get some of the ointment on, and then during the day, use a cream, which is a little bit less sticky. The ointments we can use in areas that have thick psoriasis. We tend not to use a lot of ointments, say, on the face or under the arms. They can be a little bit too strong and a little bit too sticky in those areas. But say on the arm, on the legs, on the chest, on the back, sometimes ointments work very nicely and they provide a little bit of moisture as they're applying the medication through that vehicle. There are also creams and lotions. Creams tend to be a little bit thicker. And this is important as you're thinking about moisturizing too. So creams tend to be a little bit thicker. You're gonna get a little bit more moisturization, a little thicker moisture coming out of your creams, and a little bit less so when you're thinking about your lotions. And that you can think about when you're applying to different locations. If you want to have something that's gonna be a little bit thicker, not quite as thick as an ointment, then you may wanna go with a cream. And then we have lotions, which tend to be a little more malleable. They move around a little bit, but they're not quite as hydrating as a cream. So those are some of the tools that we have available when we're thinking about topical medications. The next thing with topical medications is making sure that you're actually applying enough in order for the medication to be successful. So when we think about how much to apply, we want to make sure that there is a thin layer of the medication covering the area that's affected. We think about it in terms of fingertips. So when you're thinking about, say, like a hand, it may be like 1 fingertip amount of the cream or the ointment, and you use that for the whole hand. When we're thinking about larger body surface areas, say like the whole body, it would be like 40 little fingertips. So it really varies depending on what you're using it for, and it would be a nice conversation to talk to your physician about exactly how much for your psoriasis. So for topical steroids, we tend to apply them 1 to 2 times a day. So sometimes people forget. And one of the tricks that I tell patients when it's important to remember to do it at a certain time is using that smartphone. So you can put a little alarm in that goes boop. Oh, that's right, I gotta put on my medication. And you can do that if you're prescribed to do it morning and night. Then you put those in and you remember to do it regularly because it's going to be most helpful if you use it for the amount of times that it's prescribed. Sometimes when we're talking about the scalp area, it can be difficult to apply something in the morning time. So some of my patients tend to use their medications at nighttime. So doing the application of the solution and leaving it in overnight, that might be a little more tolerable. When we're thinking about psoriasis limited to a small body surface area, using topical steroids is one of the first things that we start with. While they can be very effective, there was really a push to try to avoid chronically using topical steroids so that we don't get some of the chronic effects we can sometimes see with using them constantly. And I'm talking about for a very long period of time, you can sometimes see depression of the skin in those areas. Sometimes you can see a more prominence of the blood vessels in that area. Sometimes patients who have stopped topical steroids after having used them for 3 months or 6 months constantly may notice redness or pain or irritation or burning at their skin sites. And this could be a sign of topical steroid withdrawal. It's not something that we see often, but in patients who are using the topical steroids chronically, this can sometimes occur, and we can help those patients out by using other medications to calm the skin down. Sometimes when we start treating, say, a small area of psoriasis, the topical steroid can be helpful to use for a set period of time, to use it constantly. You're using it for, say, like 2 weeks or 3 weeks or a few weeks. And once it's under control, then we try to decrease the amount of the steroids that you need. What we can sometimes do is use, say, the vitamin D analogs, and we'll use them like Monday through Friday, and then on the weekends do 2 days of the topical steroids. We try to decrease the amount that we're using. In addition to the vitamin D analogs, there are calcineurin inhibitors which are used, which is another form of topical medication that can be applied. And then we have newer medications that have come out that include aryl hydrocarbon receptor modulators and others as well. So those are some of the topical non-steroidal medications. Hopefully this has been helpful in terms of thinking about how to use topical medications. Do not be afraid to reach out to your physician to ask if you need help in how exactly to use it. Using it correctly is super important, because if you want to see results, we need to make sure the medication is getting to where it needs to go to. The other thing is there are multiple different kinds of vehicles that can be available for use. If you're finding that you're not using something because it is getting stuck in your hair or it's too greasy for your skin, if you're not using it, it's not doing what it needs to. So it's important to reach out if you think that you may benefit from a slightly different vehicle or a slightly different type of medication topically. Thanks so much for watching. For more information about psoriasis, topical medications for psoriasis, and other medications for psoriasis, like and subscribe.